Psychotherapy process we saw is a 7-step process. Step 1, case history. Step 2, psychological testing. Step 3, diagnosis. Step 4, pathogenesis. Step 5, treatment plan or therapy. Step 6, supervision. And step 7, termination. In this session, we'll take a look at step 6, supervision. What is supervision? When you do therapy, there is nothing like a perfect therapy or a perfect therapist. Over a period of time, as we get more experienced and more knowledgeable, we make less mistakes, but there's nothing like a mistake-free therapy. Involvement of the therapist in the therapy process and the pathology and the past of the therapist himself, they bring in a personal element to therapy. No therapist can be completely free from his own past, and because of it, the therapist can get entangled in certain unconscious processes. Because of these reasons of limited knowledge of the therapist and limited working out of his own unconscious, no matter how long he has been in training, because of these reasons and because of the way the process is going between the two, a third person who can view this process, view the two players in the process, the therapist and the patient, and if the third person who is an expert, a more experienced therapist, if he can give some input, it can possibly help both the therapist and the therapy process and thereby the patient. This third person is called the supervisor. So every therapist has to have a supervisor, and as a therapist we don't have to take supervision for every patient we see. We also don't have to take supervision for all the sessions of any given patient. So when we say supervision, if you are seeing 10 patients and let us say out of those 10, 2 are difficult, you can go for supervision of those 2 patients. And in that case, you don't have to take transcript of every session or video recording of every session as the case may be. Usually it is transcript. If you are practicing ISTDP or certain forms of therapy, it is videotape. Of course, in every case, prior consent of the patient is essential. So if we have 10 patients and you find 2 difficult, you can take only those 2 for supervision, not necessary to take all the patients for supervision. But if you are in training, then it's a good idea to take supervision for every patient you see. And usually in training, they insist that as a part of the training, you should at least get 250 sessions supervised or 500 sessions supervised. Minimum would be 100. So supervision is very much a part of the training of a therapist, and supervision also is a lifelong process even after you become a therapist. So every therapist has to have a supervisor, and patients that we find most difficult, for those patients we should take supervision from somebody who is senior, more experienced, wiser than us. For the patients for whom we seek supervision, we can take either one session per month for supervision or one session per week as the difficulty may be. Certain points where we clearly realize that we need supervision are this: healing is not proceeding, or positive therapeutic alliance is not building up, or transferences are not happening, the patient is keeping distant, or you fear the patient may leave, or you feel very disturbed in the session or after the session. You feel something is escaping you and it's just not coming up in the discussions. Or you feel there is a difficulty you just don't understand. Or you understand the difficulty, you know the problem and the solution, but you don't know the specifics of implementing the solution. In any of the situation, you go for supervision. It is not necessary that you should have one supervisor of lifetime. You can have one supervisor or two supervisors. Usually it is better not to go for more than two at one time, but over a period of time, you can take supervision from a variety of supervisors. Not only variety of supervisors, but supervisors from different countries who come with practice in different cultural backgrounds. So the more variety of supervision you take, more you evolve and more enriched the practice gets. Over a period of time, we should take supervision from as different supervisors as possible. But on a long-term basis, we should have one supervisor who is a regular supervisor on a long-term basis. There is also a question of, okay, when we are in training, after the first year, some colleges allow it, we can go for two different supervisors and see, compare and contrast and learn from both how they supervise cases differently. There is also this concept of a consultant supervisor. For example, if I have a general supervisor on a long-term basis, but he is a Freudian. Now I get a patient where the split is open. I know the solution is to go to the depressive position, but I don't know what statements to use, how to handle this transition, how to help the patient go from paranoid schizoid position to a depressive position. So I know it conceptually, but I don't know it operationally in terms of doing it in therapy. A Kleinian supervisor can help, but my supervisor is not a Kleinian. So for a short period of time, after discussing with my supervisor, I can take short-term supervision from somebody who is expert in a very specific area, and that supervisor is what is called a consultant supervisor. For supervision, usually we take a transcript. Transcript meaning it's a verbatim note of what has happened in the session. So if I take a session for supervision, I write down what I said in response to it, what did the patient say? Then what did I say? Then what did the patient say? And I also note down whether or after a particular intervention, the patient got angry or the patient went silent or there was a long pause or a short pause. And that is called a verbatim note of the session is called a transcript. So I can take a transcript of a session for supervision, or in certain forms of therapy like ISTDP, video recording is done and the video is taken for supervision. In either case, prior consent of the patient is essential. Supervision can be done in a variety of ways. Some supervisors like to do group supervision, some like to do individual supervision. and we can go for either of them or both of them. In group supervision, one person who brings a case reads out the transcript. First, he gives the background of the patient, case history in short, and then reads out the transcript. And then usually the supervisor invites comments from everybody and then gives his own supervision, which goes on for an extended period of time, usually going up half an hour or 1 hour. So this happens in group supervision, where the supervisor in a group, and this is usually the format in psychoanalytic training or in colleges which teach psychoanalysis. This also can be a format if a supervisor is coming from outside and everyone in the city who is practicing wants to take advantage of his presence. So group supervision can happen at various levels, at the student level, also at the professional level. At professional level, everyone contributes substantially. At the student level, usually it is a supervisor who contributes and the rest of them are learning. So group supervision is one way to do supervision. Second is individual supervision. If the person who brings the case for supervision doesn't want that his way of working should be revealed or anything personal to him should be revealed, then he goes for individual supervision. Supervision is almost like half a therapy, because when the supervisor analyzes how we have responded to certain things, our own unconscious gets into discussion. So there is no way we can avoid our personal details in the process of supervision. So one of the limitations of group supervision is confidentiality of the therapist cannot be fully secured. Whereas in individual supervision, it can be secure. But in group supervision, we get ideas from many people apart from the supervisor. In individual supervision, we get ideas only from the supervisor. One of my teachers used to say that if it comes to a choice between having a good therapist or a good supervisor, we should go for a good supervisor. The process of supervision can be done in many ways. Two popular ways are, one is I call it play it again, meaning the supervisor asks you to read out the complete transcript or see the complete video and then understand it fully, make his notes, and then again ask you to start again and then go into discussion line by line, or if it's a video, then frame by frame. So the supervisor goes through the whole session and then again comes back to the session, goes through the whole session, reflects upon it, writes down the notes, and then comes again to the session and then discusses it. So he can discuss every point of the session in the light of the whole session. Second way to supervise is to do it as we go, where the supervisor asks you to read the transcript and after every statement, he starts discussion. He does not go through the whole. He goes through line by line and starts discussing. Which is better? If we look at the play it again format, it is very harsh in a way upon the therapist or the tutor. Because when the actual therapy happened, the person never knew what is going to happen next. Whereas the supervision is happening after knowing the full session. So why is after the event can play out in that supervision. However, the good part is that while in terms of evaluation of the therapist, it is very harsh, or let me not use the word harsh, let me say it's very demanding. However, from point of view of accelerating therapy and contributing to therapy, this is a better format. The second one, as we go line by line, is very just to the therapist, because the supervisor knows as much as the therapist knew at a particular point in time, and therefore wisdom after the event does not play out in this format. However, from the point of view of contributing to therapy, this is usually less resourceful than the play it again format. So both have their uses, but personally I would prefer play it again format for enriching therapy. And for training, I would use both of them. And the second one, as we go, particularly to stop at every moment and in the face of the unknown, reflect what various options are there at every point. And then come back again, and if necessary, do it a play it again format. Unfortunately, what has happened in supervision is, instead of supervision being seen as something to help the therapist learn and something to help the therapy process to accelerate healing, it has unfortunately become a narcissistic enterprise of fault finding and ego gratification of the supervisor. And that has created such a castrating tradition in psychoanalysis that we find very few psychoanalysts who actually have the courage to be original, because they have been castrated so severely in the supervision process. So one of the unfortunate parts of supervision in psychoanalysis has been the use of supervision as a castrating narcissistic enterprise by the supervisor. And that has retarded, arrested originality and innovation in psychoanalysis. So choose your supervisor even more carefully than you choose your therapist. Thank you. And if any questions you have, write to me at hvindia@gmail.com.